Today I will be performing an intradermal injection. First, I will start off with my orders, which is purified protein derivative, 0.1 milliliter intradermally times 1 dose. And then I will align that with my 5 rights of medication, ensuring that this is the right medication. So the order was for a tuberculin skin test, so PPD is the appropriate medication for the procedure. Then I will go with the dose. 0.1 milliliters is appropriate for an intradermal injection. And then make sure it's the right route, which is intradermal, which is also appropriate. And then I will go with the right time. And then I will collect my material, which will be an insulin syringe, which is 0.1 milliliter insulin syringe, 28 gauge, and it is 1/2 of an inch of a needle. My purified protein derivative, which I'll ensure doesn't have any like white floaties, it should be clear. And then ensure that it's within date and doesn't have another patient's name on it or any indicator saying that I should not use it, and some alcohol prep pads. Then I will collect one of my alcohol prep pads. Wipe the cap. Let it dry a little. Take my syringe. Draw 10 units of air. Remove my needle. And then inject the syringe into the vial. And then inject the air. Turn it upside down. Draw up 10 units. And use the scoop method. Ensuring that I don't have any air bubbles. Then I'll collect my material and go into my patient's room. Good afternoon. My name is Jendrick from UAM. Could you tell me your full name and date of birth? Then make sure I have the right patient, which is Mr. Disembodied, in room so-and-so. I will be performing your intradermal injection today. Is that all right with you? And then could I see your right forearm? I'll try to locate a ventral surface on the arm, appropriate area for the intradermal injection. And then I just need a moment to prep my material. Then once I locate my site, ventral surface of the right forearm, I'm going to start from the site in a circular motion outward. Let it air dry. Click my needle. Remove the cap. Ensure that the bevel is up. Hold the skin taut. And then let my patient know they'll feel a small pinch. Make sure I can see the bevel up within the skin. And then at a 15 to 5 degree angle, inject my 10 units. Remove the needle. Instruct my patient to not put pressure on it or scratch or rub on it. Cap my needle. Throw it into the sharps container. I'm going to show you my injection site. Hopefully it doesn't bust. And then I'll tell my patient, do not rub or scratch at the injection site. And then I will take a pen or annotate the dimensions of the wheel. And then I'll ask him not to rub or itch at it and try not to lay or put any pressure upon it. And let me know if you feel any itching or burning sensations. And then I'll remove my gloves. Hand hygiene. Clean up my area, but for demonstration purposes, I'm going to keep it as it is. And then I will go and then document my procedures and annotate how it went, and then annotate the dimensions of the wheel and how the patient tolerated it. And then I am done performing my intradermal injection.